Hello, thank you for joining me today at the Burke Neurological Institute. Behind me, there are scientists actively working on finding treatments for all sorts of neurological disorders. Sometimes decoding the topics that scientists talk about can be difficult. Today, we're presenting a 4-part video series that we hope will help to decode an important complex topic, stroke. Enjoy this short video. I'll see you on the other side.
Part 1. An Introduction to Stroke. Imagine you're about to leave work and you notice that your colleague's smile suddenly looks crooked, or you're visiting your grandmother when she appears to lose function in one arm. These can be signs of a stroke, and it's time to act fast. Each letter in the word fast can help you to remember the signs of a stroke and what to do. F stands for face, a droop or visible weakness on one side. A stands for arm, when one arm becomes limp or unable to move. S stands for speech that is unclear or garbled. T stands for time, and if you or someone you know has one or more of these stroke symptoms, it's definitely time to get help. According to the Centers for Disease Control, approximately 795,000 people in the U.S. have a stroke each year, yet many people are unfamiliar with the words used to describe stroke. Let's decode some of the most common terms now. Let's start with the word stroke. What is a stroke? According to the American Stroke Association, a stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. When that happens, part of the brain can't get the blood and oxygen it needs, causing brain cells to die. There are several types of strokes. The most common type of stroke is called an ischemic stroke, which accounts for about 85% of all strokes. An ischemic stroke occurs when a blood clot caused by fatty deposits or cholesterol plaques interrupts the blood flow to the brain. If it happens in one of the major arteries leading to the brain, such as the middle cerebral artery, this is called a cerebral thrombosis. Clots can also form in other parts of the body and travel to the brain. When that happens, it's referred to as a cerebral embolism. In some cases, only small blood vessels are blocked within the brain. These are called lacunar strokes. You may have experienced or heard of someone who's had temporary stroke symptoms. Some people incorrectly use the term mini-stroke to describe this, but it is actually a transient ischemic attack, or TIA. In a TIA, the blockage to the brain is short-term, but a TIA can often be a warning sign of a larger stroke. About 15% of all strokes are hemorrhagic. A hemorrhagic stroke occurs when a blood vessel ruptures, causing bleeding. If the vessel bursts within the brain, it's called an intracerebral hemorrhage. If it happens on the brain's surface, it may be a subarachnoid hemorrhage, referring to a space below the skull. You may have heard of an injection that is sometimes given to patients in the emergency room during a stroke, called TPA. TPA stands for Tissue Plasminogen Activator. TPA is a drug given to destroy blood clots that can cause an ischemic stroke. However, it must be given within just a few hours of the onset of stroke to be effective, and can never be given during a suspected hemorrhage. Another technique used to stop a stroke in its tracks is a thrombectomy, a surgical procedure used to remove a blood clot by inserting a catheter into the blocked blood vessel, restoring blood flow. Imaging technology is the best way to confirm the presence and type of stroke. A CT or CAT scan is one type of imaging. CT stands for computerized tomography. During a CT scan, rotating X-ray machines and computers reveal cross-sectional images of soft tissue and blood vessels in the head, making it useful for spotting signs of bleeding. Another type of imaging technology that you may have heard of is magnetic resonance imaging, or MRI, which uses a magnetic field and radio waves to provide a highly detailed image. These are just two of the many types of imaging that can help doctors to better understand stroke. Difficulties following stroke can vary and are largely determined by the location and size of the stroke. These include difficulties with lower limbs and balance, deficits of the upper limb and with activities of daily living, impairments of speech, swallowing, language ability, and cognition or thinking skills, and difficulties with vision. We will be looking at each of these areas in parts 2 and 3 of this video series. Stroke is complex, but we hope that this introduction to key medical and scientific terms about stroke has helped you to understand stroke a bit better. The researchers, scientists, and clinicians at the Burke Neurological Institute, an affiliate of Weill Cornell Medicine, thank you for your interest. Please join us for the rest of this series, Decoding Stroke, when we will explore stroke motor recovery, aphasia, and the newest developments in stroke research at BNI and elsewhere.
Welcome back. If you enjoyed this video, please join us again. And don't forget to check out our website at burke.weill.cornell.edu to learn more about us and about our ongoing clinical trials.